Hello and welcome. My name is Patrick Massey. I'm an internal medicine physician and researcher, and my bio, if you're interested, can be found on my website at altmed.org. Now, today we're going to be talking about a relatively common and very underdiagnosed medical condition known as subclinical hypothyroidism. This is a condition that is actually quite common here in the U.S. and may be the root cause of a number of subsequent medical conditions. A little housekeeping first. This lecture is not meant to diagnose or treat any medical condition. It is for educational purposes only. That being said, let's get going. Subclinical hypothyroidism is defined with two factors. One is that the TSH, or thyroid stimulating hormone, is a little bit higher and usually outside of the reference range found in the labs. And the thyroid hormone, specifically free thyroxine and free triiodothyronine, are found within the reference range. So usually if TSH is elevated, the thyroid levels are low, and in this case TSH is elevated and the thyroid levels are within the reference range. Now, this is not an absolute written in stone definition, because the literature in this area is still pretty inadequate, and consensus statements are usually the result of an expert panel opinion rather than strictly evidence-based research. The symptoms of subclinical hypothyroidism are very similar to hypothyroidism, but usually milder. So we can have fatigue, we can have mild depression, and constipation. Constipation is a pretty common symptom. Cold intolerance, even in summer. People will be wearing sweaters and have a difficult time in air conditioning because of the cold intolerance. This is something I find to be a very common symptom in this condition. Changes in thinking, people will say that they're just not as sharp as they used to be, that their mind is kind of foggy. And there's this consistent weight gain no matter what you do. So you can go on strict diets, you can go on big exercise plans, and really maybe lose a few pounds, but overall the weight just keeps increasing. And the most common symptom I see when my patients come in and see me is they'll say, I just don't feel right. And then we talk about other things, and these other symptoms will manifest themselves. So what does the thyroid do? Let's start with that. Thyroid hormone is made in the thyroid gland, and it regulates the metabolic processes that are essential for normal growth and development, and regulates metabolism. The TSH, however, the thyroid stimulating hormone, is not made in the thyroid gland. It's made in the pituitary gland, and then stimulates the thyroid gland to make thyroid hormone. There are 4 thyroid hormones that we generally follow. The first one is T4, or a thyroid hormone with 4 iodines. Then there is free T4, which is unbound to serum proteins. T3, which is thyroid hormone with 3 iodines, and free T3 again is unbound to serum proteins. There are other types of subclinical hypothyroidism that I feel are valid, and because I've seen them over my years of practicing. One of them is that the TSH levels fall well within the normal range, but that there is a low T3 and or low T4, and this is something I see relatively often. This is probably the most common form of subclinical hypothyroidism. The symptoms of this form of hypothyroidism are, again, weight gain, fatigue, foggy thinking, memory issues, dry skin, constipation, irritable bowel, whatever. Another form of subclinical hypothyroidism is a normal TSH as well as a normal T4, but a low T3. This is one that I think gets missed by a lot of physicians because we generally don't test T3. We simply test TSH and T4. And so what happens is that T4 is biochemically inactive. T4 has to be converted into T3 in order to become biochemically and metabolically active. So if your T4 is normal and your T3 is low, that means that there is some issue with the conversion of T4 into T3, resulting in the symptoms of weight gain, fatigue, foggy thinking, memory issues, dry skin, etc. How many people have this condition? Well, it's been estimated that at least 10% of the U.S. population, 30 million people, could be diagnosed with subclinical hypothyroidism. That's a lot of people. And 20% of this 30 million is found in the elderly. So for older people who already may have other reasons for gaining weight, foggy thinking, and being fatigued and being tired, constipated, for example, this is something that is usually overlooked in the elderly because there may be other reasons for it. But it's a very common medical illness because I think that it's actually underestimated. I think it's more than 30 million people based upon the patients who I see in my practice. And it is rarely diagnosed, and when it is diagnosed, it's rarely treated appropriately. But somebody would say, well, it's mild. So what? So what? It's just mild. It's not really you're not going to be hospitalized for it. You're not going to the emergency room for it. It may impact your quality of life to some degree, but it's mild. Well, let's look at the heart and its relationship to mild thyroid failure. We know that in mild thyroid failure that the heart has impaired contractility at rest or with exercise, which means that it's not as strong of a muscle pumping out blood to the rest of the body, and this has effects throughout your body not being able to get the right amount of blood at rest and with exercise. So you can get tired with exercise really fast. There is significant impairment of exercise-related stroke volume, which means that the heart is not only is it not pumping very strong, but the amount of blood that's being pumped out is diminished, and this results in less blood getting into the aorta and at less velocity. So the blood isn't getting to where it needs to go at the rate that it needs to go. And there's also decreased lung capacity, decreased anaerobic thresholds, which means that you fatigue more rapidly, and there is a decrease in the ability to take up and utilize oxygen. Now, although not severe, like I said, you're not going to be hospitalized for this or go to the emergency room for this. Just like compounding interest over time, chronic deficiencies have serious outcomes. All serious chronic medical issues, medical conditions start with less serious medical issues that were not treated. So pre-diabetes is an untreated form of diabetes. Osteopenia is an untreated form of osteoporosis for the bone. Mild congestive heart failure is a more mild condition than serious heart failure. And interestingly, heart disease is the #1 cause of death in the United States. And why is this important? Well, we can see that there are risk factors that are important for heart disease, and these are high cholesterol, high blood pressure, smoking is a risk factor, diabetes is a risk factor. But interestingly, subacute or subclinical hypothyroidism is also a risk factor, and it's a risk factor that is comparable to high cholesterol and to diabetes. So we treat people with high cholesterol, we treat people with high blood pressure, we treat people with smoking, we treat people with diabetes, but 30 million Americans are not being treated for subclinical hypothyroidism, even though it is a significant risk factor of actually having a heart attack. So why treat? Well, all of the symptoms of subclinical hypothyroidism can improve. And many of these symptoms are also precursor symptoms of other chronic medical conditions. So skin can get better. It can not be as dry and irritating. You can lose weight. The fatigue improves. Depression gets better. Your cholesterol levels go down. Lung function improves so that your fatigue will improve. Your exercise tolerance will improve. Blood pressure gets better, reduces the risk of having a heart attack. Cardiac function improves. Really everything. So the reason for treating the symptoms of subclinical hypothyroidism is because everything gets better. The traditional treatment for this condition is the use of a medication, levothyroxine, which is actually T4, it's thyroid hormone with 4 iodines, is often the drug of choice. Now, that doesn't mean it's the optimal drug. It simply is the drug that most doctors will use in treating this. However, if T3 is low, there may be a problem in converting T4 into T3, and there are reasons for this, and we'll get into them in just a minute. So adding more T4 will really yield minimal results because you're not going to be getting more T3, and having more T4 may actually increase the side effects that you can get from too much levothyroxine. Sometimes a combination of T4 and T3, such as a medication such as Armour Thyroid or NP Thyroid, I have no connection with these pharmaceuticals, I have found to be often more effective. So if we talk about non-traditional therapies, if you Google thyroid or hypothyroidism, or you get a book talking about the thyroid gland, or you get on blogs and websites, really one of the things that it is pushed very, very aggressively is if there's something wrong with your thyroid, you need more iodine. And there's not a lot of instances where that's necessarily true in this country. In addition, iodine may be beneficial. There's no doubt about that. But in some cases, too much iodine may be quite harmful, because in the presence of too much iodine, the thyroid will undergo something known as the Wolff-Chaikoff block and actually stop producing thyroid hormone. So you can take too much iodine and actually become profoundly hypothyroid. And I've seen this, and it's kind of like if you flood the engine of your car with too much gas. Car's not going to run, no matter how much more gas you put in it. I'm a big fan of food as being the best way to get iodine, either through kelp or iodized salt or even meat, because they use iodine as a antibacterial and antifungal in meat. Thyroid gland products are very common in non-traditional therapies. I'm not a big fan of these because they contain thyroid hormones. So a thyroid gland product, what they'll do is they'll take a pig or a cow, and they grind it up, and they'll add other vitamins and whatever else to it, and they'll put it into a capsule, and you take it. But they don't tell you actually how much thyroid hormone is in each capsule. And some of them will say that they get rid of the majority of the hormone, but they can't tell you how much is left or how much they got rid of, and it probably varies with each batch, because if they standardized it and advertised it as a standardized amount, it moves from being a supplement to being arguably a drug, and then the FDA comes in and shuts them down. So are there medications that affect thyroid hormones? Okay, and the answer is yes. And this is an issue that in traditional medicine we really don't think very much about. Things that decrease thyroid stimulating hormone, dopamine and levodopa used in Parkinson's patients. Bromocriptine actually works on the pituitary gland where TSH is made. It affects prolactin levels. It affects TSH levels. It's used in some cases for patients with diabetes. All these things can decrease TSH, therefore decreasing the levels of thyroid hormone. Steroids and amphetamines do this also. Increasing TSH, metoclopramide, which is used as an anti-motion sickness medication, amiodarone, which is a heart medication. We'll see that in just a second. And even for a short period of time, iodinated contrast media will increase TSH. Increasing levels of T4, we know that iodine can do that, and iodine is found in many prescriptions, cough and cold preparations, dietary supplements. Amiodarone is a heart medication, and it has, by composition, it's almost 40% iodine. And then we have iodine-induced hyperthyroidism, which is the opposite of the hypothyroidism from the Wolff-Chaikoff block. So it can go either way if there's too much iodine. preventing the conversion of T4 into T3, which can result in subclinical hypothyroidism. We see that iodine can do this. One of the most commonly used medications in the modern history of medicine are beta blockers. They have saved many, many lives. Propranolol, altenolol, metoprolol, and there are others. And the side effects from beta blockers are dizziness, weakness, fatigue, cold hands and cold feet, dry mouth, dry skin, weight gain, slow thinking, and it's probably related to inducing, with these medications, inducing a state of subclinical hypothyroidism. And large doses of corticosteroids can affect the conversion of T4 into T3. So people who are chronically on steroids for autoimmune diseases, for example, are at risk of subclinical hypothyroidism. Stress increases levels of cortisol. This is a steroid hormone, slows the conversion of T4 to T3. Interestingly, changes in bowel function and the intestinal flora. T4 in the bowel is converted into T3 sulfate and triiodoacetic acid, and these are inactive, and that's in people whose bowels are not doing well. They have a lot of bad bacteria, or they have a lot of bowel issues, irritable bowel, Crohn's disease, ulcerative colitis. You need good gut bacteria to convert T4 into T3. Chronic stress also suppresses the pituitary gland and TSH. We saw that. And chronic stress will affect the organs of detoxifications. There is a form of T3 called reverse T3 that is made when your body is under chronic stress, and it actually turns your body off. It lowers your metabolism. It's used primarily when your body is under a great deal of stress, so that you can hibernate and save your resources. And these organs of detoxification help to limit the production of reverse T3. Sleep is absolutely essential for the prevention of subclinical hypothyroidism, and poor sleep increases cortisol levels, and that's a steroid, and we know what that does. It affects the conversion of T4 into T3. Only 14 days of poor sleep will significantly reduce the production of thyroid-stimulating hormone in the pituitary gland, and as a result, the levels of free T4 and T3. Diet is another factor, perhaps not in the way that we normally think about it. So people who have an iodine-free diet are at risk of subclinical hypothyroidism because they may have low levels of iodine. Now, there is no good way of measuring iodine in the body. Different tissues concentrate iodine in different amounts, and the serum levels are pretty unreliable, as are the urine challenge tests. If you have a salt-free diet, or you're using non-iodized salt, that can put you at increased risk depending upon what your diet is like. And if you don't eat meat, if you're a vegan or a vegetarian, iodine solutions are used as a way of making sure that meat in packing houses is not contaminated with bacteria or fungus. A diet that's low in selenium has a profound effect on the thyroid's ability to actually make thyroid hormones. So you could have subclinical hypothyroidism and have a normal TSH, but just have low T4 and T3 numbers simply because of your selenium levels. So this is rare in this part of the country, but there are parts of the world where this is a very common finding. Calorie-restricted diets, the very severe ones, 800 calories a day, 1,000 calories a day, will dramatically reduce the production of T3 and increase the production of reverse T3, because your body looks at these kinds of diets as a stressor, and we need to hibernate in order to conserve resources. Overexercise is another good reason for developing subclinical hypothyroidism, and I'm talking about overexercise. Initially, you'll have an increase in T3 and T4, and you'll feel pretty good for a couple of weeks. I'm exercising, I'm feeling great. And then over time, within about 6 to 8 weeks or so, you're going to find that you're more tired. after strenuous exercise, and this is because your body is now reducing T3 and increasing reverse T3 because the over-exercise is being recognized as a stressor rather than a benefit. And this is probably the reason why if you over-exercise, at about 2 months, you can actually start feeling weaker. You can start losing strength instead of gaining strength. So instead of lifting 180 pounds, now you can only lift 175 or 170 pounds. You're more tired. You can't do as many reps. It is because of this. And it's also an effect of this is an increase in cortisol. Anytime you're doing any kind of exercise, especially if you're over-exercising, your body will be releasing cortisol. And if you're really over-exercising, this will be a chronic stress response. And long-term, your metabolism will dramatically reduce. Simply because you are now in a subclinical hypothyroid mode. So, do I have subclinical hypothyroidism? And the answer is it's certainly possible, but you need to find an MD who believes you. Not all doctors really believe that subclinical hypothyroidism not necessarily exists, but is something that's worth treating. You want to be your own advocate. You want to be persistent. In today's medical world, it may take 3 or 4 conversations with your physician for them to want to treat you even minimally. Do you have the symptoms? You need to have more than 1 or 2 symptoms. So if you're not able to lose weight and you're tired, that may not be enough to give you all the clinical symptoms for subclinical hypothyroidism. You also want to have a battery of tests, of thyroid tests. One test does not tell the whole story. TSH by itself, TSH is almost a worthless test. And that's the one thing that we get in medicine on a regular basis. You want to check other lab tests also. Low adrenal function often goes hand in hand with subclinical hypothyroidism. And also realize that reference range on your lab results does not mean the optimal range. For most of the tests that we order, we actually don't know what the optimal range is because we have never looked. And there's a lot of debate on this, but I think that this is. But don't just go by reference range. So if you don't question, you'll never get answers. I want to thank you, and I wish you all the success in your health journey. If for more lectures on health topics, blending the best of traditional and non-traditional medicine, please follow me on YouTube. That's where I'm going to be posting them, or I have posted them. Please sign up if you're interested. Please sign up for my newsletter blog. You can sign up on my website at alt-med.org. There's a little sign up icon on the front page. It says sign up for my newsletter. If you sign up for my newsletter, you automatically sign up for my blog. If you have topics that you want me to address, then my email address is am4011@juno.com. If you have questions about simple questions about this particular lecture, you can also ask that. I do not give out medical advice because my malpractice insurance does not allow me to do so, and the federal government doesn't allow me to do so across state lines. So best wishes, and I hope that you have a wonderful day.